So in this video, I'm going to be showing you how to train your shoulder internal rotation using a Progressive Angular Isometric Load, or a PAIL. And we're going to be doing this on the floor using a weight. You can use a kettlebell or a dumbbell. I prefer a kettlebell because the height is a little bit more appropriate for this drill, or at least the height of the handle. And just to review, a Progressive Angular Isometric Load for shoulder internal rotation. So if we go to end range shoulder internal rotation, the PAIL, or the progressive angle, is going to be the angle of the motion that's getting bigger. So as I go into more internal rotation, this side of the joint is lengthening, which means we're going to be actually contracting into external rotation, but at the outer limits of internal rotation in a sideline position. So for the setup, you go on your side, make sure you have your head supported with something, just so you're comfortable. You're going to use a kettlebell or weight. You're going to keep it just in front of your sternum or so, because you're going to have this elbow right in line with your shoulder. So you're just going to get into a normal sleeper stretch. But instead of you just holding it with your other hand, you're going to come down and you're going to grab the handle. Now, using this position right here, we're going to hold here for a second just to review what we're doing. So remember, this is the angle that's getting bigger as I go into more internal rotation, right? So I'm going to contract into external rotation. And what that's going to look like is I'm going to try and hover this weight a millimeter off the ground, and we're going to try and hold it there, okay? So this may be challenging depending on the weight that you chose, but you want to try and choose a weight that you can just barely lift off, because that's going to give you the feedback whether or not you're actually really trying your hardest. You can choose a weight that you can't lift off, that's fine, as long as you continually try and maximally lift up as safely as you can, right? Or as safe as you can tolerate. So you're going to start by contracting everything. You're irradiating, you're creating tension, you're driving your elbow into the ground. Now as you squeeze this handle, you're going to try and hover a millimeter off the ground and hold for about 10 seconds. And then when you're done, you bring it back down. Now, what we just did there is we were doing what's called a yielding isometric. So we're trying to lift the weight up a millimeter off the ground, but we're holding it in that position. So that's the isometric that we're going to use to load into external rotation in this internally rotated position. Now what you can do here is you can actually change the level of horizontal abduction by simply going from a sideline position to a supine position. Now for this supine position, it's going to be a little bit harder. So you'll notice you might have the same weight that you just picked up in that sideline position or here in this adducted position, but here in abduction, as you try and lift that up, it's going to be a little bit harder, or depending on where your strengths and weaknesses are. So that's a shoulder internal rotation, PAILs contraction in a sideline position and supine position.